Hi, I'm John Lamott from the Central Ohio Area Agency on Aging. Welcome to our series, Medicare for Beginners. In this segment, we will be talking about Medicare's Part A program and how it works. Before we begin, here is a brief overview of Medicare. What is Medicare? Medicare is a federal government health insurance program. It provides coverage to persons who are age 65 and older, and also younger persons who may be receiving Social Security disability benefits, or persons who have end-stage renal disease which requires dialysis or a transplant. Medicare recipients must be a U.S. citizen or an individual lawfully admitted for permanent residence who has also resided in the U.S. continuously during the 5 years immediately preceding the month of the application for Medicare. There are two options for Medicare coverage: Original Medicare, which include Medicare Part A and B, or Medicare Advantage plans. There are additional video sessions like this one that will provide information about Medicare B and Medicare Advantage. Medicare Part A is financed from a portion of the Social Security taxes that workers pay. If someone has earned enough Social Security credits to be entitled to monthly Social Security benefits, then their Medicare Part A will not have a premium. Premium-free Part A benefits can also be provided to spouses and sometimes children of retired, disabled, or deceased individuals who worked. Persons with insufficient Social Security earned credits may purchase Medicare Part A benefits. Medicare Part A is the part of Medicare that pays expenses when a person has been admitted into a hospital. It does not provide coverage outside the United States. Medicare Part A does not have preferred provider networks. Medicare Part A can pay for expenses at any hospital or medical facility that accepts Medicare for payment. Medicare Part A covers inpatient care in a hospital, care in a skilled nursing facility for up to 100 days if admitted directly from a hospital, home health care in some instances, and hospice care can also be provided. Medicare Part A does not cover doctor's charges or care in a nursing facility that is custodial or considered long-term care. You can enroll in Medicare Part A during the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Contact Social Security to enroll in Medicare Part A. Applications may be filed online at Social Security's website, by making an appointment at Social Security's toll-free number 1-800-772-1213, or by visiting a Social Security office. If you elected to receive Social Security or railroad retirement benefits before you are age 65, enrollment into Medicare will be done by those agencies automatically. To learn more about Medicare, we invite you to attend one of our free Medicare for Beginners programs, which are held monthly at the offices of COAAA. Look for other segments in this series where we will discuss the other parts of the Medicare program. There are also resources on our website, www.coaaa.org.
The Central Ohio Area Agency on Aging supports people as they navigate the experience of aging or disability. We connect people with services that help keep them safe and healthy at home, such as homemaking assistance, transportation, home-delivered meals, and personal care. We offer education and resources to caregivers, professionals, and the public, and advocate for programs and policies that benefit older adults and individuals with disabilities.